There are some telltale signs that you can look out for when deciding whether or not you have irritated tonsils or not. The best way of preventing this condition is avoiding contact with viruses, germs and bacteria that may cause tonsillitis. Experts recommend that you wash your hands frequently and avoid sharing glasses or utensils with people who are sick to help you avoid getting infected tonsillitis. However, this list is only a first step and you should always get a proper diagnosis from your doctor before reaching any conclusions, especially if you have no fever. Rapid symptoms. Tonsillitis develops suddenly with pain when you are swallowing and a sore throat. Also, it causes your tonsils and throat tissues to swell and the air passages in and out of your respiratory system become blocked. Pain. Pain within the anterior neck area is another general symptom of irritated tonsils, and it will vary from one individual to the next based on what is causing the infection. Always keep in mind, though, that general pain could be a symptom of something more serious than irritated tonsils alone. Specific issues. Symptoms of irritated tonsils might also include a sore throat sound/voice distortion, colored coatings on your tonsils, swollen neck, glands, chills, fever, much redder tonsils than usual. Very contagious. When an individual comes into contact with the fluids of somebody who has tonsillitis, the person can also become infected with tonsillitis. That is due to the fact that tonsillitis is a contagious disease that may spread from one person to another. It is very common among school-age and preschool-age children. Color. After the tonsils have become infected, they begin to change color. On inspection, this can be identified. They might have bright red spots on them or appear as white and green spots. Those are pus pockets that form within the tonsils layers. Long-term pain. A tonsil attack often develops to the chronic stage. At that point, the body might not have the ability to defend itself against bacteria and allergies. Physicians usually use strong antibiotics for treating infected tonsils. However, if it occurs repeatedly twice per year, it is advised to have a surgery called a tonsillectomy to remove the adenoids. Cough. Throat irritation develops not just from inflamed tonsils, but rubbing against foods that have been consumed. Symptoms such as sore throat and throat irritation may indicate that a sinus infection is present, particularly in patients who are suffering with a runny nose, nasal congestion, sneezing and a cough. Bleeding. Other tonsillitis symptoms include bleeding or raw patches on the tonsils, difficulty swallowing, bad breath, swollen lymph nodes, abdominal pain, severe headache, rheumatic fever. Untreated infected tonsils might lead to complications such as rheumatic fever, which may permanently damage the heart. A bacterial infection or viral infection are the common causes of tonsillitis. Bacterial tonsillitis results in sudden and severe fever and swollen lymph nodes, whereas viral tonsillitis has cold-like symptoms. 5 steps for getting rid of irritated tonsils, natural and synthetic cures. As mentioned earlier, although they may be very uncomfortable, they do not always warrant an immediate visit to the doctor's office since they can be effectively treated at home. So what helps reduce swollen tonsils? Here are 5 steps you can take towards remedying irritated or swollen tonsils before going to see the doctor. Increase the humidity levels. By using a humidifier or sitting in a nice and steamy room, you can increase the humidity in your environment. If the irritation is even partly due to a dry environment, this goes a long way in soothing it. Another alternative is to get some water boiling, pour it into a clean basin and lean over the basin, placing a towel over your head and breathe in and out to soothe the throat and drain the sinuses. Gargle it away. This is really a great enlarged tonsils home remedy. Just salt and water. With a warm water and salt solution, gargle several times throughout the day. Not only will the salt water relieve the irritation and pain in the throat, it also helps to reduce the swelling. To make the solution, in 8 ounces of warm water, dissolve 1 teaspoon of salt, just as simple as that. Opt for warm beverages. To ease the discomfort as well as reduce any swelling, drink warm beverages such as warm water, tea and even broths or certain herbal teas. The emphasis here is on warm. If the beverages are too hot, the opposite effect occurs and additional throat pain could ensue. Over-the-counter pain medications. If the pain is intense, you can turn to over-the-counter pain relievers for comfort, which can be taken as needed. There are also throat sprays or throat lozenges that contain various pain relievers, for example benzocaine, along with various others over-the-counter pain relievers. Rest. One of the best ways for the body to naturally heal itself is by getting plenty of proper rest. It is also important to rest your throat by avoiding activities which may cause further irritation, for example smoking, talking for long periods of time, yelling, etc. Don't forget to like our video.